Welcome to the 2022 BIPOC Perioperative Leaders to Know. My name is Carissa Brewster, staff writer for Women Partners, and today we have Jannette Gray, who is the Clinical Effectiveness Consultant with Sutter Health. Welcome, Jannette.
Thank you for having me.
You're welcome. Thanks for being with us. So my first question to you is, what drew you into the perioperative field?
So I have always been interested in medicine, and I was actually pre-med at one point. And after I had followed a doctor and I kind of saw what the nurses got to do, I was like, I'd rather be a nurse. I love the hands-on. But what drew me to perioperative services is the options. I'm a person who likes to master something, and then I look for a new challenge. And within perioperative services, there's so many pathways you could take. As a staff nurse, you have endoscopy in the procedure world, or you can go OR, which has different specialties within that specialty. And or you can go admissions, recovery room. There's so many things you can do. You can do them all. And in my case, I've done a lot of them. Once I got bored or I felt like I've mastered something, I would look for a new challenge and change fields. And I could do that in perioperative services. Not only that, you have the hospital aspect, which I also have done, and then the ambulatory surgery world, which is a whole new ball game where you still use the same skills, but it's got different applications. So I love the different options.
That's great that you have that experience with the operating room in a hospital and also ASCs. Awesome. How has COVID impacted your approach to leadership?
Well, it's forced us to be more flexible and to be more open-minded about how you approach problems and solving problems. I remember when we first were notified about the issue, and it was like the whole world came to a halt, yet healthcare didn't stop. And we had to figure out how we're going to keep people safe, how we're going to keep staff safe, and without really knowing what's going on fully. Like, we didn't know how the virus was contracted. We didn't know all the risk factors, but you had to kind of extrapolate based off of, previous knowledge and figure out how to keep everybody safe, how to keep people working, how to change with all the changing regulations and rules that were coming out almost daily. So it really, I think it proved us as leaders, because you couldn't have one approach to anything. You had to diversify.
Right. So have you ever experienced discrimination in your career? And if you have, how was that handled, and how did that impact you personally and professionally?
I think every person of color has a story. There's no way to get through life as a person of color without a story of something that's personally happened to you or that you've witnessed. I have a few. I think one of the ones that comes to mind is I was a new manager about 6 years ago, and I had a boss who felt very comfortable with saying what was on her mind. And there were times when she would say something about another staff person of color. And I was in that new awkward situation where I was like, here's the person who has my career in their hands, but they're saying something that's really inappropriate. What do I do? Do I stand up and say something and potentially deal with the ramifications of how that may come out? Or do I stay quiet and then be disappointed in myself for not speaking up? Especially when, as leaders, we're always telling people to speak up for safety, to say when you have a concern, and to advocate for the people who can't advocate for themselves. So I've been in some awkward positions where I had to think about that. And I mean, even just going to meetings, in other roles and other jobs, you're always reading the room to figure out what can I say? How do I say it? Will they understand where I'm coming from? Was that too ethnic or was that not ethnic enough? And it's concerns that people don't, people who are not of color, they don't go through life thinking like that. They don't see how their words land and did it come across right? Am I fitting a stereotype or reinforcing a stereotype with what I'm wearing or how I speak or what I'm saying? There's a lot where you go through life and you're always thinking, how did that impact? How did that land? Am I representing my race in a good way? So it's pervasive, and I've had to struggle with it as a new nurse, and I've struggled with it as a leader, because as a new nurse, you're figuring out the ropes, you're figuring out what the boundaries are, and you start your career thinking, I work hard, do a good job, and I will advance. And then you realize it's not that. It's who you know, how you know them, and what they feel about you. And then as a leader, you're thinking about cultural bias. You're thinking about what I say and how I come across. There's been many a times when a staff member has come to me and spoken to me, and then someone else came up and goes, "Oh my God, she was an angry Black lady." And you're like, and you immediately want to be like, you don't get to say that, but you gotta make sure that your message comes across the right way, and that you're educating, that you're coaching, and that you're mentoring, and that you're not reinforcing a stereotype when you are upset about things that you see happen or you hear happen. So it's just everywhere. It's been throughout my entire career. It'll be there throughout the rest of my career. And it's something that we're always aware of. Even in meetings, I remember being in a meeting and getting a text, smile, you got RBF, and you're like, do other people of non-color get texts like that? Where you're told to, be friendly, come across as friendly, smile, fix your face, So it happens.
It's crazy. It's like you can't just exist sometimes.
No, sometimes you're like, can I just sit here and be authentic? You're talking crazy, and my face is reflecting that.
Exactly.
That doesn't mean, I'm unapproachable or I'm angry.
So what is your advice to aspiring, BIPOC nurses and periop that want to be leaders? Like you mentioned some of your experiences that you've had. Kind of what's your kind of quick advice for people that want to move up?
Develop a thick skin and know who you are. If you don't know who you are, someone's going to tell you who you are, and you're going to find yourself in a place where you don't recognize yourself, you don't recognize what you're doing, and you'll feel lost. Be authentic to yourself, but at the same time, we have to be aware of how we come across, what we say, how we do things, and you really have to hold yourself to a higher level. Unfortunately, but it's just the reality of it is what it is.
Yeah. What do you think search firms like us, talent agencies like us, talent acquisition professionals, what administration at hospitals, what can they all do to kind of promote diversity and equity and inclusion in the operating room?
You hear those keywords thrown out so often, and a lot of people feel like because they use those words that they're open-minded and that they're, bias-free. And you have to acknowledge that there are existing biases. It's so pervasive in our world today that all you can do is acknowledge. And if you really are about diversity, equity, and inclusion, then really be about it, because hearing it, we hear those words all day long as people of color, and then we don't see the action. It really matters that you back up your words with actions.
Did you have a mentor coming up through Periop? And if so, how did they impact your career?
I had a couple of mentors. I've had a mentor of color, and I've had a mentor who was white or Caucasian, whatever the politically correct term is. It was interesting because my mentor of color would help me navigate some of the roadblocks that you run into as a leader of color. And she helped me to learn how to read the room from a professional standpoint, you know. Whereas I learned more of the on-the-job training from my mentor who was of non-color. So if you can, I recommend getting as many mentors as possible, because the more you know, the better you can be. You incorporate what works, and then you get rid of the stuff that doesn't help and doesn't translate, or you don't agree with. But you also get a diverse influx of knowledge from different perspectives. And sometimes hearing the two different perspectives helps you find another perspective that can make you more successful.
Mm-hmm. What are 3 key areas you believe a mentor should cover for their mentee in Periop?
I think you really need to understand your role, and sometimes the mentor can help you avoid pitfalls. So it's really good to be able to listen and hear the words, and sometimes hear the words that aren't being said. But they will help you avoid pitfalls. They will help you understand your role and your part in whatever aspect of the career you're being trained or mentored in. And it's so much easier when you're not teaching everything to yourself, but you can learn from somebody who's been there, done that, who's made the mistakes and can help you avoid them. You're going to make mistakes, but there are mistakes that you can bounce back from, and then there are mistakes that once they happen, they are career altering. So it's very important to have a mentor who can help guide you, especially when you're new to the role or new to a job.
Mm-hmm. Mm-hmm. My next question is kind of about the headspace our country has been in for the last, I don't know, 5 years. And it's kind of, begun to seep into like the workplace, especially like, I guess, year COVID dropped. What are your thoughts on how to handle that in the workplace? What's the boundary, I guess, for politics coming into the workplace, and when do you kind of go like, okay, this is enough? What's appropriate? What's appropriate?
Yeah, it's a very delicate line. With COVID, you have the stressors that came along with COVID and the pandemic. People being quarantined with their loved ones for months on end, that was a stressor I don't think anyone could anticipate. And it has had deep impact on how people respond to basic issues. Like, we used to have people come in and you tell them, oh, you need to do this. Okay, no problem. Now, after COVID, a patient comes in, you tell them you need to put a mask on. And we've had people have full-on 3-year-old tantrums, meltdowns. And it's just, people are tired. They are tired of the pandemic. They are tired of all the rules. They're tired of the regulations. They're tired of all the changes. I mean, life went from being, oh, okay, I want to go to the store, I'm just going to hop in the car and go to the store, to, I mean, in the very beginning, you were like in a hazmat suit, gloves, and a mask, and you were worried, am I going to die just going to the store? And that's a stressor all on its own. And then that's just like someone who's healthy. Put someone who has comorbidities, other health issues, and, or just mental health issues. And we've ratcheted that pressure cooker up to the nth level. And then, we're still trying to function as a society.
Yeah, it
Then
feels
you
like the
have,
dam burst in 2020, and COVID was kind of the cherry on top of like this super sweet cake.
and then we had George Floyd, and we had Black Lives Matter, and we had rioting, and it was, I think, exacerbated by COVID. But it's just years of anger, hurt, and oppression. And I mean, this is the first time I've ever seen a whole worldwide a group of people coming together to say something's not right. I mean, there were protests in Germany, France, about what happened here in America. Obviously, it's been a very deep impact. And I think that all the tensions and stressors have risen to a level where things that would have been, okay, yeah, I had a racist encounter, you shrug it off and keep going. That's the straw that breaks the camel's back now, because people are just done. And it's really forced us as healthcare professionals to have to take that in consideration, because now you're having patients who are coming in, they're sick, they're scared, they've got all this stress, they've had all this other stimuli, and they have no reserves. So if you add to their stress, you could have, a mass shooting in your place. People are on edge, and it's really changed how we have to interact with people. We have to be kinder, gentler,
Yeah.
even with just communicating. We need you to put your mask on. Some people, they have a meltdown, and you can't just be like, well, you can leave. They still need help. So how do you address that? How do you de-escalate? We've started teaching our staff de-escalation techniques. It's changed how we interact, and how we as leaders are coaching and mentoring our staff.
Mm-hmm. That's good to know. Because I mean, as it is, nurses get a lot of abuse heaped on them anyway. So I can't even imagine what's been going on for the last 2 years.
Well, imagine being in the hospital and your loved one is dying from COVID, and you're being told you can't see them. And that's your whole world. And this nurse is the only thing blocking you from seeing your whole world. And it's understandable when people lose it.
Yeah.
So we've really had to make some changes, to keep our staff safe, keep people safe, and still be compassionate and human.
Yeah. Yes. Yes. Speaking of nurse stress, the staff shortage is another stress for nurses that is the gift that keeps on giving. What do you think are some ways that the industry can shore up the pipeline to peri-op nursing in specifically?
So prior to the pandemic, I think that it was easy to attract nurses to the profession. I mean, we had the different options. Like, you graduate from nursing school and you have so many different avenues to go down, and then you're well paid, and you could kind of figure out how your life you wanted your life to look like, and find something that matched it. But now we do have nursing shortages, we have staff shortages, yet it's still hard to find a job. If you want to be in a certain area, you got to know somebody who knows somebody that can help you get into whatever system you're looking for, because we're in a situation where we're critically short, yet you can't put a brand new nurse in a hotbed of issues and expect them to thrive.
Yeah, they need to be
So the
trained.
hospitals aren't looking for brand new grads. ASCs aren't looking for new grads. So how are we bridging that gap? That's where we got to kind of focus. How can we get the nurses the experience they need so they can be helpful? Because there was a point in time when we were so short-staffed during COVID that we would take any nurse, brand new off the street, retired, haven't worked in years. We were taking them in because we were critically short and we needed the help. But were we being fair to those people? I mean, if you haven't passed meds in 10 years, so much has changed. It's not the 5 rights anymore, it's the 8 rights. How are you going to know that if you haven't been working for the last 10 years, you know? And if you're brand new, you don't have someone that can have that dedicated time to mentor you and shadow you. Sometimes you were like, you've been through nursing school, you learned this, you see one doing and get in there, you know, and it's not fair to it's not fair to the new grads. So we need to find a way to bridge that gap and create those opportunities so they can be what we're looking for to fill the openings that we do have.
Awesome. That was the last question, actually. And I want to thank you for being here. It was great talking with you and meeting you. And I love all of you guys have such great answers and they're so different, but I love it.
Well, thank you so much for having me. It was